Please help me in welcoming my friend and colleague, Clareen Wiencek. Good morning, Houston. A year ago in another great southern town, New Orleans, I announced this year's theme, It Matters, by quoting the powerful words of Dr. Martin Luther King. Our lives begin to end the day we become silent about things that matter. I believe this moving and inspiring declaration lies at the heart of the most important work we do as nurses. When we use our voice to advocate for our patients and families, it matters. When we speak up to create healthy work environments and drive change needed in our units and systems, it matters. And when we speak on a national level in a united voice that drives change in healthcare and elevates our role as nurses, believe me, it matters. Our voices speak from experience. It's the nurse the patient's wife speaks to at 3 o'clock in the morning to say, "My husband does not want to do this anymore." It's the nurse the patient remembers after a successful resuscitation and says, "You saved my life." It's the nurse's voice the patient remembers. Like the member of the AACN San Diego chapter who used her voice to ensure that a positive outcome came from a tragic situation. She told me, "I was caring for a patient who had undergone a lung transplant the day before when she suffered a major stroke. She quickly progressed to brain death. Of course, her family was devastated, but they wanted to give the gift of life to someone else. The nurse then told me how difficult the process was to arrange the donation. You know how that is, coordinating a huge effort in the midst of a family's and the team's grief. But in the end, they did it. In the end, the family was able to make sure her heart would help save someone else's life. For this family, this nurse was the architect of the memory. It was a very emotional experience for everyone," she said, "but I fought for that patient's family so that something positive could come out of a sad situation. And the next day, I took care of the patient who received her heart." I heard countless stories like this as I visited your units and chapters this year, and I just have to ask, does any other profession even come close to owning and sharing such powerful stories? Of course, the answer is no. So listen to Gordon Natal's story. A practicing nurse in the intensive care unit in the emergency room for 3 decades, Gordon cared for a patient who had suffered a stroke. He says she was intubated, she was extremely obese, and it was difficult to take care of her. It always took more than one nurse to give her care. But Gordon would always talk to her, tell her what he was going to do before he did it, assuming she could hear him. Sometime later, Gordon was walking down the hallway with a coworker when he heard someone call his name. This person looked at Gordon and said, "Do you remember me? You took care of me in the intensive care unit when I had a stroke. You always talked to me. Although everyone thought I did not hear or know what you were saying because I had a stroke. However, I did hear everything. You were so kind to me. I just want to thank you." Gordon's voice mattered. It mattered to this patient because it was evidence that he valued who she was as a person. Gordon's voice mattered, and our voice matters. In fact, according to Jason Leach, our voice might be the most important vital sign of all. Jason is Clinical Director of Scotland's National Health Service and a Fellow at IHI, the Institute for Healthcare Improvement. In his TED Talk, "What Matters to Me, A New Vital Sign," Jason tells the story of Rose, an older patient with dementia known for her agitation and frequent falls. What mattered to Rose was praying her rosary beads. In fact, that seemed to be all that mattered. Luckily, one of her nurses found out how much the rosary mattered. And when the nurse placed it in her hand, Rose was transformed. Before, she was someone with something the matter, an older, demented fall risk. Now, Rose became someone to whom something mattered, a woman at whose bedside visitors and staff could sit with to pray. And this transformation occurred because a nurse reached in to find the person that Rose still was. A nurse reached in and discovered what still mattered to Rose, simply praying her rosary. Now, Jason talks about the importance of identifying what matters to patients. Instead of asking that question that we ask all the time, what's the matter with you? He says we should ask, what matters to you? I found it transformative to think about this question, and as a palliative care nurse practitioner, I now consider it as vital when I talk with patients and families as all those other vital signs we take so frequently. So, what matters to you? Take a few moments and really think about it. I asked the same question often when I met with nurses this year. What matters to you? What brings you joy? And I can boil down the most common responses to two simple words: love and family. But I was also happy to hear many nurses say that the experience of being a nurse, the human-centeredness, the values unique to our profession, enjoying the people that we work with every day, referred to as our family, also filled our lives with joy. Now, of course, I also received some messages about frustration with nursing turnover and concern for the safety and the work environment. I know these are difficult and persistent challenges that might sometimes seem insurmountable. But I have also seen evidence that when we use our voices collectively, problems can be solved, because we know the load is lighter when everyone carries their share. So let me give you an example. For our AACN Clinical Scene Investigator Academy, or CSI, nurses at 4 Boston area hospitals focus their improvement projects on the prevention, recognition, and management of delirium. Each hospital created a project led and staffed by nurses to help alleviate the prevalence and the long-term consequences of delirium. And collectively, they made a huge impact. A project at just one hospital in Boston decreased ventilator days by 50 in just 1 quarter. And the 4 participating hospitals estimated an annual cost reduction of, get this, $4.4 million. Okay. But even more significant is the impact that these projects had on patients and the quality of their lives. Critical care staff nurse Kathy Manning of Bay State Medical Center said this about her CSI experience. Because of this work, we've had the opportunity to collaborate with colleagues from several Boston area hospitals to form a groundbreaking nursing consortium focused on improving recognition and treatment of delirium. Amazing. These courageous nurses from 4 different hospitals defied corporate rules and regional competition because it was good for patients. Imagine if nurses did this across the country, and that would become the norm, not the exception. Now that is a story we should shout from the top of all of our helipads. So competition was a barrier for these Boston nurses, but no more. But what barriers do you encounter? Nurses performing non-nursing tasks, not enough break time to take care of yourselves, team members following evidence-based protocols, not following evidence-based protocols. I know you encounter barriers to caring for your patients. I know that you may sometimes feel taken for granted, invisible in our increasingly complex hospitals. But I also know that we are indomitable, with a will and a courage impossible to defeat. Like steel, we are tough and resilient at the same time. And we are at the bedside, competent and compassionate when our patients need us the most. This indomitable will forms the basis for a voice that cannot be silenced. Just as we each own our individual practice, we also own the health of our work environments. When healthy, these environments allow nurses to thrive. But when they're unhealthy, they can lead to suboptimal outcomes for patients and nurses. They can even lead to burnout. So this year, AACN used our voice on the national level to address the critical issue of burnout syndrome. Working with our physician colleagues as part of the Critical Care Society's collaborative, we provided guidance on lessening the development of burnout and called for research to find ways to prevent and treat it. And when U.S. News and World Report published a supplement about burnout in the healthcare system that neglected to mention nurses at all, AACN reached out boldly to educate U.S. News that burnout impacts nurses too. Our efforts open dialogue about future work U.S. News is planning. Every one of us, individually and collectively, has a part to play in eliminating burnout, and we must use our bold voices to speak up and take care of each other. So Suzanne Gordon is an American journalist and author of multiple books on nursing's public image. She has written a great book, From Silence to Voice, What Nurses Know and Must Communicate to the Public. In this book, she implores us to change the way we talk about nursing and caring and to boldly inform the public in terms they understand. She implores us to have ready that quick response to that proverbial question, what do nurses do? Well, here is my answer. Nurses save lives, they prevent or relieve suffering in the most vulnerable of patients, and provide most of the value that hospitals offer. What is your response to that question? So, heeding her advice, and at the urging of my mentor, AACN past president, and University of Virginia School of Nursing Dean Dori Fontaine, I used my voice to speak up and speak out about the need for better palliative care. I wrote a piece for Huffington Post called Defying a Death-Defying Culture. I thought it was a small step until I learned that the Huffington Post has over 200 million unique visitors each month. That is a lot of patients, families, and caregivers who now hopefully know more about palliative care. In our own way, each of us as nurses can help the public understand the work we do. So Peter DeMarco is a journalist. He understands what nurses do. He wrote about life support being withdrawn from his 34-year-old wife, Laura. Her nurses, Donna and Jen, arranged for him to lie in bed with his wife for one final hour. In the New York Times, Peter wrote, "I will remember that last hour together for the rest of my life. It was a gift beyond gifts, and I have Donna and Jen to thank for it." And I have Donna and Jen to thank for it. It matters. Donna and Jen matter. Now, last year at NTI, I told a story about myself as a new graduate working the night shift. My patient had gone into full cardiac arrest, and the other night shift nurse and I, she was a veteran of 30 years, tried valiantly but unsuccessfully to resuscitate him. The next day, I heard through the rumor mill that the other nurse believed that my inexperience as a new graduate contributed to the unsuccessful resuscitation. Now, it was a long time ago, but let me tell you, that devastated me. But even more devastating was the fact that I did not talk to my coworker or anybody else for that matter, to understand what I had done wrong or right, I did not use my voice. I remained silent about something that mattered. I now stand before you as the veteran nurse. I proudly wear my experience on my face and in my joints and in my heart. And today I am encouraged and inspired. Why? Because you used your bold voices this year to let me know what matters to you. You absolutely transformed It Matters for me. You spoke to me in emails and social media and chapter meetings and tours of your units and conferences to let me know. You inspired me with the different ways you demonstrated that it matters. And as I visited you from Atlanta to Denver to Seattle to Houston, you told me what matters most to you. Now I want to give a shout out to the West Houston chapter, who last summer started a word cloud about what matters. I loved that. I loved that so much that in fact I asked other nurses across the country as I traveled to add to that word cloud, and you received a bandana this morning as a visual reminder of what matters. So when I introduced the theme last year at NTI in New Orleans, I was a little worried. I worried that it was too vague and too abstract. I worried that it would not resonate with you, my community of exceptional nurses, and I fretted over this talk because I thought I did not have that one compelling story that would make you laugh, or more importantly, make you cry. But one day I realized that you are my story. And above all, I wanted to let each of you know just how much you, the vital work you do, and the profession you define matter. Of course, a recent Gallup poll named nursing the most trusted profession for the 15th consecutive year. I just have to say, of course. Okay? So as my term comes to a close, I am more humble than when I started. Thank you all for the joy you have given me. Before I finish, I need to answer the question, what matters to me? So that's easy. My family and my AACN community. I want to thank my husband, Jim, my daughter, Julie, son and family, Jimmy, Mary Louise, and Anne Marie, for their unconditional support during a year when they could not keep track of what city I was flying to. I know I barely could. Okay? You give joy and meaning to my life. And to my sisters and my in-laws and my friends with me today, yours are the hands that have guided me to this stage. And to my other family, my AACN family, I say this: never doubt that you matter. And that your voice matters. It matters because it enables all of us to provide human-centered care that transforms our patients' lives and preserves our families' memories. It matters because it allows us to relentlessly drive change vital for our patients, for the units and systems where we work, and for this honored profession we call nursing. So it fills me with great pride and joy to look out at you this morning and be able to say one more time, as AACN president, we are nurses, and it matters. Thank you. Enjoy NTI.